What's going on? What's going on? Welcome to a special broadcast of World Kidney News. I am your host, Steve Belcher. If you're watching, thank you. Please share this broadcast. In light of what's going on in today's world, share this broadcast because dialysis patients definitely need to hear this broadcast, especially if you go to in-center dialysis. Before we get started, I'd like to thank our sponsor, Dialysis Warrior Gear. You can see their website scrolling across. Let me just show you. If you're looking for a mask, there you go. Boom. Dialysis Warrior Gear. You can get a mask like that. Then he has different styles right there as well. So again, if you're looking for a mask and you can So tonight, we're going to be talking about managing your care during the coronavirus, especially if you're a kidney warrior. Now, the Washington Post on the 24th of March did an article called Dialysis Patients Are at High Risk During COVID-19 Outbreak. And these are some of the important points that I took away from the article. The physicians and experts are concerned because packed together in group settings, dialysis patients are going to be vulnerable, especially if it's an onslaught of the coronavirus, which they're expecting. Another concern is due to large facilities and others with dozens of patients, that could put patients at risk. Also, doctors fear if COVID-19 spread in treatment clinics, patients seeking dialysis will flood overburdened and under-equipped ERs. Also, what's that concern? Clinics are running short, right, of supplies, masks, gowns, face shields, possibly gloves. So what's happening? The CDC, FMC, and DaVita, they're trying to develop ways to separate the well patients from the infected, because they say it's going to be necessary in the coming weeks. So they may know something we don't know. To help us get through this topic or discussion tonight, we have Kidney Warrior, 29 years in the field as a patient, also expert education specialist on kidney disease, involved with certain committees, CMS committees, task force. So here to help us talk about this is Dawn P. Edwards from Queens, New York. Hey, Dawn, how you doing?
Hey everybody, how you doing? I hope everybody's staying well.
Yeah, Dawn, what's going on? What exactly is going on with dialysis clinics, especially in New York, which is considered ground zero?
Yeah, it's really rough up here in Big Apple. I'm a part of the task force for ESRD Network Number 2, which covers the state of New York. And we have some really startling information that's coming in on a regular basis from our dialysis facilities. And the biggest issue to sum it all up is that our dialysis facilities were not prepared for a onslaught of this virus and at this magnitude. And our emergency preparedness plans were not geared towards pandemic. And this is really challenging for our dialysis centers right now.
So we were pretty much geared toward like natural disasters, power failures,
Right,
hurricanes, stuff like that, tornadoes. But now we have a new challenge, which is a virus, which is a pandemic across the globe.
right. We were pretty much prepared for something that may interrupt service or interrupt the treatment schedules. But for something like this, where treatment has to continue going on through the whole peak and valley of this virus crisis, we are really in we're really in a quandary right now.
All right. Guys, if you're watching this video, this broadcast, please, I can't tell you how important this topic is that we're going to discuss for the next maybe 40 minutes. Maybe it could be an hour. We got Warriors Quest coming up at 8:30 with Jared A. Brown. But this topic and information that Don has is very, very pertinent, and especially to kidney warriors who go into in-center hemodialysis. So, Don, let's just kind of break it down. One concern is packed together in group settings,
Right.
worried about the onslaught of coronavirus cases. Um, Even though we see a small cases in dialysis clinics, there have been some reported. In fact, the first two dialysis cases were reported at Northwest
Right.
Dialysis Centers in Seattle, Washington.
Yeah, those were the
Um,
first two deaths.
right. Now, what is the standard distance now before the coronavirus with patients in center? Isn't there like a CMS standard setting between each dialysis station?
Yes, and it's about 3 to 4 feet. It's considerably less than the 6 foot requirement for social distancing in the pandemic. So that's a clear indication that the chairs are too close together. They have too many patients in too small a space by square foot, and that leaves patients susceptible to infect one another. And that is why it is absolutely mandatory that every patient wears a mask upon entering the facility until the time that they leave the facility, because you are vulnerable and you're susceptible at any given time.
Absolutely. Now, what about units? And I know New York is the Big Apple,
Right.
8 million people or more.
Yeah.
Now, I'm sure that there's large facilities up there. What's the largest facility you know about in New York, in the state of New
Wh-
York? What's the largest chair size?
The largest facility that I know of is right out here in Queens, New York. And then I know of another huge one in Brooklyn,
But what's the
and
chair size?
it's 53 stations.
53 stations.
Yes.
Jesus.
And then the next largest is, I believe, 51 in Brooklyn.
53 stations. Now, are they filled 6 days a week,
Yes,
3 shifts each day?
that's correct. To
Jesus.
capacity.
Wow.
Yes. So now imagine all those people in one big room, with staff members, because you have to have your patient staff ratio.
Ratio.
So you're
Right.
full of patients, you're full of staff, and these are all of these people are circulating in one big room. So that's a room full of germs.
And especially patients that may be coming from nursing homes. Now,
Absolutely.
we know, and we haven't even gotten into patients who may come from nursing homes that may have dementia and could be possibly infected, and they don't want to wear the mask, and they may forget and pull the mask
Yes.
off and
Yes.
start coughing.
It's a huge challenge. So not only do we have, like you say, in the patients with dementia, or patients that that have mental health issues. We
Right,
have pediatric units where children don't want to keep the mask on. And we have our geriatrics, like you're saying, where patients don't want to wear masks. But we also have people without mental health issues, and I'm wondering what their level of their meaning of not having mental health issues. But we have people who are refusing to wear their mask in the
really.
dialysis unit, and I find that to be just like almost committing suicide. Under these circumstances, there's an absolute must that you wear, that mask, not only to protect others from you, because it takes 5 to 14 days before symptoms even show up. So you can be carrying the virus and spreading it to others, and you be asymptomatic for anywhere from 5 to 14 days.
Right,
So that's something that patients aren't aware of.
right. Let
So
me
you need to, sure, jump in.
no,
Sure.
what I was going to say, we have some comments that I wanted to
Oh, yes,
speak
please.
on. Shamika Small, she said, can they extend their hours and run smaller groups? Talking about for the
Well,
clinics.
now that is something that is being discussed, Shamika. The only thing about that is they have to pay people. And when you pay people, especially in New York, if you pay people to work extended hours, our clinics are already open until after midnight. So
Wow.
you're talking about night differential, overtime possibly, because what is another issue that's happening is that the staff members are getting sick as well, and it's causing staff shortages. And due to the lack of PPE, some of the staff members are refusing to work, or they're walking out because they're refusing to work without their personal protective equipment.
Right.
And this is causing some staff shortages.
Okay.
So, it would be ideal to just run the clinics longer, but you have people at work that you have to accommodate their hours. Transportation is not going to run all night for every, for every patient. So it's a lot of logistics involved.
Sure. Um, Look, if you're watching this broadcast, please share. There's only 9 people in here, and it's more than 500,000 people on kidney
Woo.
dialysis. So come on, guys, share this broadcast. If you know family members, aunts, uncles who deal with kidney failure that goes to outpatient treatment, they need to be in here watching this broadcast. Seriously. We had another comment from Paul Taylor. He's just blown away. He's like, wow.
Yeah.
We have Shamika came back with another.
Hey, Shamika.
Oh,
Here's
we
my
got
girl.
Shamika Jones. Okay, I forgot it's 2 of them. Hey, Shamika Jones and Shamika Smalls. God bless you.
Both
Thanks
of
for
them,
watching.
yeah.
But Shamika Jones says some centers are cutting the runtime, so it's not as many patients. And that's a shame that they got to cut people's treatment just to get past this situation, because that means you putting someone's life in jeopardy by cutting their treatment time when they're normally 4 hours and you reducing it to 3.5. And we know that more treatment is better. So less treatment would be not better. So that's doing a disservice for the patient. Shamika Small, she says, wow, she can't believe it. KRN jumped in and she says, wow, she's surprised as well. Shamika shared it. Thanks, Shamika. Appreciate you. And Shamika Jones said, hey, Steve and Don. Hey, Shamika, I hope you're doing well.
That's my soldier.
Yeah, stay safe down there, dear, please. So, Don, what about, you said you're on the task force for the whole state. Are there concerns about, due to the large facilities, dozens of patients could expose other ones at risk as well?
Absolutely. I mean, that's the major concern. What they're trying to figure out, and New York is going to be like the catalyst for the rest of the country. For right now, we have over 30,000 cases of COVID up here in New York, as compared to other states. The next state that has the most highest amount is New Jersey, and they only have about 3,000 or something like that cases. So New York has the most in the country right now. So we're pretty much leading the pack on how we're going to handle this, and other states are going to follow. And the biggest problem is what to do with these infected patients. And we haven't really reached the peak of our infection status. Um, the governor just said that we won't hit our peak until maybe another 14 to 21 days. So we still have a lot more people to go to be infected. And with that comes more dialysis patients, which just exasperates our problem.
Wow. Now, so they're fearing that the spread, that COVID-19 is going to spread in treatment centers, and that the possibility of sending patients to the ER, flooding the system.
Yeah. Sending having to send dialysis patients to the ER is a disaster and a nightmare waiting to happen, because not only might they need ventilators, but they're going to have to also get dialysis treatments.
And there's
And
not that
that's a
many
whole nother.
dialysis nurses.
Exactly. So we cannot have, and we cannot have this swell of dialysis patients, which is why they are really trying to keep these patients infection free, to keep them out of the hospital system.
Yeah, I'm gonna be honest. If I was still working and if I found myself in this situation, they're gonna be paying me some money. They're gonna be paying me some money to put myself at risk like this. And it's a shame that dialysis staff have to go through wearing masks for a week or wearing them till
Sure.
they get soiled or wet. But if I was
Yeah.
working in a hospital, I mean, I could see if it's only two of us doing acutes and it was an onslaught of this, man, we'll be burnt out. I mean, I'll be getting paid, my
Absolutely.
they be taxing me, I'll be getting paid, but I'll be mentally exhausted and
Yeah.
drained, anxiety, worrying about bringing this home. I'll be probably scrubbing myself down before I leave the hospital, throwing my
You
scrubs
can't even
away.
go home with the same clothes. You can't go home in those scrubs,
No,
you
no, them
know?
scrubs will be coming off.
Yeah. But now
Absolutely.
let me bring another thought into mind. Now you nurses and doctors and all of you professionals, you guys are covered under the Hippocratic oath, and you took this oath to do no harm and all about all this. But let's think about the technicians. They just coming in, basically kind of off the street to do this job and maintain these treatments and everything. They don't really have that sense of go get them and saving lives like you all professionals who have invested your life into your training and schooling and all of that. They can walk right off the job and go to Walmart and get a job.
Absolutely. And that's what we talk about nowadays, that it's not like it used to be with
No.
technicians coming in and
No.
having other medical background
Right.
experience or interaction. Like you said, they could just come in from Walmart, leave there, and they're high as long as they got a GED, which is nothing is wrong with a GED. But if that's all you
Right.
got and you ain't got no more education to contribute to it, then it may be an issue. You know what I'm saying?
Yeah, I feel bad for them because they don't have the equipment that they need, and they are exposed, to the same health issues as people who have invested their life into this healthcare training,
Absolutely.
which I mean, our people in the grocery stores are just as exposed now. If we really want to
I mean,
talk
pretty
about
much
it,
everybody's is
right?
at risk
Everybody's
and
vulnerable
exposed.
right now. Yeah,
Absolutely.
yeah.
Now, Don, one of the big problems, I guess you, not I guess, but you mentioned clinics are running short of supplies.
Yeah.
Now, what's do you know exactly what supplies that they are running short of?
Well, as you see on the news, the masks are a huge problem. If they have to distribute one mask to every patient, for every dialysis treatment, for every shift, that's taking masks away from the staff members.
Right.
So mass is a huge issue. The gowns are another huge issue. Those things have to be, those are paper. You take those off and throw them away.
Sure.
And from what I'm reading and what I'm getting an understanding of, the large dialysis facilities, as you know, they order those things in bulk. They can share with one another. Those things come from big storehouses. They have to. So I'm not sure if they are having the same issues. But the smaller dialysis facilities, they are really suffering with lack of this with this PPE.
Sure. Now, Don mentioned masks. Again, want to shout out to our partner, uh, Dallas's Warrior Gear. If any warriors looking at this right now and you need a mask, Dallas's Warrior Gear will customize and make you a mask right for you and your family. He got one Harry Potter and another one with some diamonds. So if
Look
you
at
need
that.
a
That's cool.
mask,
That's cool right there.
yeah,
I like
you
that
can get
diamond
one
one.
from Dialysis warrior gear. We have his information scrolling across. They're going out like hotcakes. So don't be out. Don't be caught without one. So Don, now we're going to get in because I know you have some tips for people for in-center dialysis. Because oh yeah, guys, this is part one of a two-part series. The second part will be this Friday, the 27th at 10 p.m. So be here, same time, same bat channel. But before we get into the tips that you have, Don, on staying safe for in-center, as I mentioned, this article from the Washington Post, they said that the CDC, FMC, and DaVita are collaborating to develop ways to separate the well from the infected. They said this is necessary because they predict that it's an onslaught of coming on. So what are some of the recommendations, Don, that the task force has been hearing on separating the sick from the well?
Well, the first thing that they were discussing was to move all of the sick patients onto the last shift. So if you have any sick patients or any infected patients, they want to isolate them by putting them on the last shift. So this way, all of the well patients can get their treatment and they can get out of the way so that the patients on the last shift can be the infected patients. And then that seemed like a smart move to me. um some centers uh only have one patient so that it's easy to isolate, but in these larger centers you have more than one patient, where you cannot isolate them, and building walls and all of that, we don't have the time, nor do we have the finance for all of that. So it's being discussed about shipping all of the sick patients or all of the infected patients to one specific unit, and we just have one unit for each one of the boroughs for infected patients, and they be treated there. One of the last things, and we're hoping that this is never comes into play, but if they do have these continued staff shortages and what have you, and they have to treat these patients, they're talking about only doing 2 days a week dialysis, and rotating the patients in that way so that they don't overwhelm the staff. So that
Now,
depends on how many infected patients we get.
sure. Now, what happens with um, the state-led transportation service? Will they designate one bus to transport infected patients, or how do they separate the patients that who are infected that are not infected that may
Right. Yeah.
ride on these transportation buses that are
Well,
designated by the state or
th-
contracted?
that that's a problem right now because the MTA uh is is in charge of the paratransit service here in the five boroughs, down in the boroughs, and also upstate as well. They have paratransit service where two or three patients would be on the same bus at the same time, and for right now, they are only doing one patient per vehicle. However, the
One patient
concern
per
is,
vehicle.
yes,
Wow.
they are
I'm
not
sure
sharing.
that's a big delay for patients getting home.
Yeah, it's a nightmare. And I don't know about the private ambulette companies, how they're handling this, but the drivers are afraid of driving infected patients, and you know, and rightfully so. That is another issue that I'm sure is going to be discussed on our next call.
Right, right. Wow. Incredible. Now, let's move on to some tips you may have for our warriors that go to in-center dialysis. What kind of special now before you go on with the tips,
Uh-huh.
you know, let me just say again, guys, you can't get this information nowhere else right now. I don't see the Kidney Foundation or any other large organizations, patient-led organization out here on the front line like Urban Health Outreach Media trying to give you the up-to-date on-spot information pertaining to this COVID-19 crisis, how to stay safe, how to keep your family safe, how to be prepared in the dialysis unit, what to look for, what not to look for, and just managing your health during these crises. So before Don moves on, we're going to take a short break and be right back.
Great.
All right, we're back with World Kidney News. I am your host, Steve Belcher. Now, Don, what kind of
Yes.
tips do you have for warriors to manage their health during this COVID-19 crisis based on your experience and participation on the task force and working with CMS committees?
Well, the first thing that I'm going to say is, regardless to how you feel about it, I know it's uncomfortable to sit in that mask for your whole treatment time, but you must wear your mask. It's of the utmost importance, not only to protect yourself, but to protect others. Uh, if your staff members don't feel comfortable with being in a room full of patients where anyone could be infected, these people can stay out of work, and that will prohibit you from being able to get your treatment at your scheduled time, and that can lead to some severe health problems. If your facility is short on staff, then they can't give you the quality of care that you deserve. So follow the instructions that you're given, wear your mask, allow them to take your temperature. If your temperature is above 100.4, they are instructed to send you to the emergency room. You are not to be allowed into the treatment area if you have a temperature above 100.4. So, if they do happen to take your temperature and pre-screen you before you come in, and you have a temperature, don't get upset and get angry at the staff members. They didn't make your temperature what it is. It's a possibility that you may have the virus or another infection, and you may be susceptible to infecting someone else. So that's very important, and we want you to cooperate so everyone can get their treatment and be healthy.
Absolutely,
Uh, the next
absolutely.
thing, the next thing is wash your hands. Washing your hands is just about the only defense that we have. Hand sanitizer is good, but you have to make sure that you're looking at the bottles of hand sanitizer and make sure that it's 60% alcohol or more. Some of these hand sanitizers, some of these ones that smell really nice and have all of this lavender scent and all of that, that don't have the appropriate alcohol content, to get your hands germ free, to kill the germs on your hands. So now is a time for you to make sure that you are a smart consumer and check what it is that you're buying.
Don, let me interrupt you
Uh,
for a minute.
another, sure. Go ahead, Steve.
Um, Shamika Jones says, but now would be a good time for patients to go home. Now, by you being a home dialysis advocate, what's the skinny on training for
Mhm.
home dialysis now with Next Stage? Has those operations been halted? What's the skinny on that?
No, absolutely not. We want patients to go home. We want to get patients lined up for training. Um, there are some facilities that do have a slight backlog. However, we still want patients to go home. And, this is how you avoid having to deal with the stress and aggravation of interruption in service and wearing a mask during treatment and all of this. These home therapies are designed for patients to be able to do themselves. It's easy to do, it's safer, and this is what we've been trying to tell patients, for years, along and along now, that this is a great alternative for you. So we're really hoping that more patients will listen to us now when we come around and talk to them about home therapies and the benefits of that, and will consider going home, and not only going home, but going in to see about your transplant. Get listed for your kidney transplants if you want one. Get out there and let's start getting active for those living donors. Get a hold of Jared so he can do a post for you. Come on Warriors Quest and give your pitch for your living donor, uh, someone to volunteer to be a living donor so that you can get off dialysis and get out of the dialysis center. It's not as safe as as you think. So I'm going to go ahead with the tips for you to stay safe on dialysis. Again, I'm just going to stress
Right,
the hand washing,
right.
washing.
Actions,
Yeah, I see you
difficulty,
freezing up a little
but
bit.
we heard
You
everything
had
that you said.
Yeah. So so Steve, it seems like you're having some connection problems, but again, I just want to point out when you go into the dialysis unit and you come
Your
from
internet
outside,
connection is
is it you or me, Steve?
all right. I think that's better now.
Yeah, I hear you loud and clear.
Okay. One thing I wanted to ask you,
Hmm.
with that last tip that you were talking about,
Yes.
what was that again? Because you
Oh,
because you was it was chopping up.
I was talking about the importance of hand washing.
Right.
As soon as you come in from outside, you get to the sink before you do anything and you wash your hands. And so you've touched the doorknobs, you touched the door coming in. You want to make sure that your hands are clean. Don't touch your face or yourself or anybody or anything until you wash your hands. And
Sure.
you want to just do that more and more, even after you leave the dialysis unit.
Mm. Guys,
Uh,
no, I'm sorry, Don. I was just going to say we need more than 10 people in this on this broadcast. It's going to be over in about 20 minutes, and the part two is on Friday. It's more than 500,000 people undergoing some form of kidney dialysis, and we only got 12 people. Don, before we move on to your
yeah,
next tip, how important
sure.
is it for people to hear this information right now, especially right now?
Well, I mean, if there's 500,000 people on dialysis, that means 250,000 people are going to dialysis treatment tomorrow, and 250,000 people had treatment today. So that means that this information is a matter of life and death, and a matter of protecting yourself and keeping yourself from getting this virus that could possibly be deadly to you. And I know that maybe you've received some instruction at your dialysis center, but this virus that's going around, it's real and it's deadly, and we can't act like it doesn't exist. We have to be proactive.
Absolutely. And that's what we're trying to do right now, be proactive, get the information out there, especially the warriors who may not be able to get the information that you're privy to have, being on the COVID-19 task force for the state of New York. What's that third tip you have for us?
Okay, so the next tip is to keep yourself from getting aggravated when you come to dialysis. Don't bring anyone with you. Um, Visitors and guests are not allowed into the unit right now, and I know that can be upsetting for some people too, because a lot of people come with a family member or with their spouse or with their aide, but they're not allowing visitors or guests into the unit currently at this time, and that's only not only to protect the patients but to protect everyone. Again, the dialysis unit is full of germs and we want to protect everyone. So, in order to keep yourself from getting upset when you get to treatment because your spouse can't come in with, have them, drop you off and come back and pick you up, or, have them just stay at home until you're done with your treatment.
Well,
You know,
Don, let me interject.
Mhm. Sure.
What about patients who need assistance in getting out the wheelchair, or patients who may have some type of mental illness that requires their loved one to sit beside them, or some type of aid?
Right.
What
Now,
happens in that
I would
case?
I would imagine that would be up to the discretion of the facility if it's that severe of a case, or if it's someone that they're really having difficulty controlling, where it's going to impede the service of the other patients. That would
Sure.
be up to the discretion of the facility.
Okay.
But in most normal cases, the average patient can make it 3.5 hours, through treatment. And I don't want to negate anyone's comfort level, but if you can do without having someone with you, please don't stress everybody out, and let's try to make it to treatment and get your treatments in.
Sure. All right.
Which
What's
leads
our
me to
next
my
tip?
next tip.
Sure.
The next tip is don't miss any dialysis treatments. Don't miss your dialysis treatments. Don't get mad and say, "Oh, they don't have this and they don't have that cuz I'm not going." Because what's happening right now is critical time, and we can't stand to miss a dialysis treatment. We have fluids and toxins and waste and everything building up in our blood, and we can't stand to miss a dialysis treatment. Don't get yourself all anxious and excited and start skipping dialysis treatments, because that's only going to make matters worse. And then you can end up really in the hospital, where you're even more likely to become infected.
Don, th-
Yeah.
so there's been situations where patients didn't go to treatment because they got mad.
Yes, patients. Well, Steve, you know better than I do that
I
patients get
know,
mad
but
and
I'm
say,
just I'm
you
just
know,
playing devil.
you know,
I know. I just kind of
yeah,
You
Yeah,
know,
you know how we get pissed off and say, "Yeah, I'm gonna fix them. I ain't coming at all." You know,
hmm
and who are you hurting when you do that? You're not hurting
yourself.
the staff because that's one less person they got to monitor. You
Right.
know,
Right.
uh,
That's true.
you're hurting
That is
yourself.
true. That is
Yeah,
true. So what's the
yeah.
next tip,
So
Don?
yeah, so the next tip is to be aware of the symptoms. If you don't feel good, if you notice that you're feeling hot and cold, or you feel nauseous, you may have diarrhea, you're having some throat issues, or you're having trouble breathing, you might be feeling like you have a little temperature. We all know what it feels like to have a fever. I mean, just about all dialysis patients have had an infection at one time or another. So if you feel any of those feelings, you want to call your dialysis center before you come and let them know that you're feeling symptomatic, and let them give you instructions before you make that trip all the way down to the dialysis center and they tell you that they can't treat you and you need to go to the hospital. So if you're feeling symptomatic, call your dialysis center first and let them know that you're not feeling well, especially if you're feeling that breathing trouble, or you're having that dry cough. Those are signs that you may have some type of respiratory infection, or you may have the COVID virus. So you want to let your staff know specifically what it is, what symptoms that you have before you get there.
So
Another
Don,
thing,
how
yeah,
many cases of patients in New York have the COVID virus?
as of Tuesday, we had a count of 79 cases in New York State, and three-quarters of them were down in the New York
That's
City.
dialysis patients?
79.
Wow.
Yeah,
Wow.
yeah,
At
and I'm
different
sure
units.
at all over the city. And don't forget, there's over 200, and I believe there's 230 some dialysis units in just down, just in the New York area.
Over 200 units.
Yes. Yeah,
Wow.
we got about 250 or so units in New York.
That a
So these
lot of
79
units.
patients can these 79 patients can be anywhere. It could be a cluster in a unit in a certain region, or they could be one in each, in each unit. That's what's making it so hard to manage, because it all depends on where, these patients are located.
Right. So what's our next tip?
Okay, so the next thing, oh boy, is to avoid close contact. Again, this social distancing, I'm sure that that's going to be the newest word in Webster's dictionary now. Maintaining a, a safe distance between yourself and others. You may see your friend that you dialyze with all the time in the dialysis center, and you guys may hug, and sometimes you bring this for them and they bring that for you. And now we can't do things like that now, because we just can't be too careful. So displays of affection, we got to do the elbow bump, and all of that. And these are things that we usually don't mind, or we don't take care and take caution about. But during this time, we really have to be careful and maintain that safe distance away from one another, so that we can protect each other, and save one another's lives. you know the next thing is to avoid keep your hands out of your face.
Now,
um
uh,
yeah.
second. Now,
Hmm.
the social distancing. like you said, that's the new word. Where, as a society now, is this the new normal? I mean, are we now become a society that we don't express um emotions through touch now because of this virus, or greetings that we used to do? Like you said, someone that you want to hug, or someone that's going through something. Now, do we
Yeah,
have to test each other before we, as a society, to see who's uh infected and who's not infected, in order to hug each other now, especially people that we became fond of and near and dear for over the last maybe decade at a dialysis unit?
right.
Has this
Yeah.
what it come down to?
Steve, I'm really praying that this is not the new normal. I mean, we are people who thrive on emotion and affection, and having a chronic illness, we need the support and love of one another, and the camaraderie of the friends that we make in on this journey. And some of us, I even had some really close friends, some staff members. I'm used to hugging my nurse when I go in for clinic. That's the first thing I do when I see her is give her a big hug. She's taking care of me. But we had the elbow bump this time, and my clinic visit didn't feel quite right.
Right.
Eventually we're going to be doing these doctor's visits, through our phones and through our tablets, and the physical contact, unfortunately, is going to be limited, until this crisis subsides a bit, and then maybe can be a little less stringent with our contact with one another, because I know I hug and kiss everybody,
So
but and it's really a labor now.
right now, has the task force heard anything, or has anything been adopted through CMS on now physicians examining patients when they come into the dialysis unit to do assessments like lung and heart, and checking for edema, especially with patients who may have the virus? Has anything been discussed about assessment techniques?
I haven't heard anything specific about assessment. I will ask about it, but I would imagine those assessments are absolutely necessary under the current circumstances, especially that breathing assessment, and checking for edema. And I would imagine that those would be more necessary than ever now, because of the limited visits to the doctor and the limited exposure to outdoors and outside and traveling around and everything.
Sure,
I
but
haven't
but
heard
what
anything specific.
but what about the limited supplies? Wouldn't that probably want healthcare to prevent or limit their contact with potentially infected patients? Since you said that there's 79 that's been confirmed in the city of New
Yeah.
York.
I mean, Steve, this is part of your Hippocratic oath. As far as a nurse or a doctor, they have to do their job. And
Right.
if that patient is whether that patient is infected or not, they're coming in for a treatment, and they need to be assessed. And that's why this PPE, or protective equipment, is so necessary, because they have to come into physical contact with a patient.
And you know what,
They have
Don?
to touch that patient.
The last time I seen something like this in the dialysis community was when HIV and AIDS became a big thing
Yeah,
in the 80s, in the 90s,
yeah.
and the hepatitis B. Because
Hepatitis.
I
Yep.
yeah, because I worked at a unit before they went to the rooms, made the rooms, isolation room mandatory.
Yeah.
I worked at a DaVita unit. Yes, I said it. I worked at a DaVita unit in Baltimore that had a line. It was a red line, just a line that
Uh-huh.
separated the person who was hepatitis B. No big room, no door, nothing. It was
Wow.
just a line, a line. So
Wow.
blood, if this guy bled and blood spurted, it could
Right.
potentially
And
spurt on other people. A line.
sure.
So that's why I try to tell people I done been through something in my 33 years in dialysis
Yeah.
and I haven't seen it all, but I've seen some treacherous stuff that I'm glad that there are um 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 regulations in place to prevent
Absolutely.
prevent units or companies and separating hepatitis B people from non-infected with just a red line on the floor. So
You know,
um
that's why our forum is so important, because we're giving these patients information to protect themselves, and to keep them aware and alert and to keep them safe. And,
absolutely.
especially during this time, they don't have time right now to be walking around, sitting down, giving you, tips to keep you safe during. They're going to
No,
give
they
you a
don't.
handout,
They trying to keep their own
or they're going
self
to give you.
safe.
Right, right. So,
Mm-hmm.
this information is unbelievably important, in order for you to keep yourself safe during this crucial time.
Mm-hmm. You have any more tips for people that go in center hemodialysis?
Yeah, another one of my tips uh is your diet. Steve, you talk about this all the time. You Last week we saw you in the Dollar General, in the dollar store. I understand it. I live in a food desert as well. My supermarket, I have to get in the car and drive, to get to a nice clean supermarket. And,
Sure.
right around the corner from my house is the dollar store. So
Mm.
that's really convenient. However, the food that is available in there is not conducive to our diets. So if you're forced to go into the dollar store to pick up a couple of things because you're running low on food and supplies in the house, please be a smart consumer and check those labels out. You have to be careful of your phosphorus intake. Your bones are going to be screaming out for mercy if you let your phosphorus and your potassium get out of control. Your potassium, that controls your heart and your nerves.
Mm.
A lot of patients have neuropathy. They can't feel their fingers and their toes. That's a potassium issue. We You have to watch your potassiums and your phosphorus, and try to pick out foods that fall within, our kidney friendly diet. Spam, Vienna sausage, sausages, bacon, all of those processed meats and things that are in the dollar store. Those are not those are not conducive to our diet. If you have to have some type of protein, I mean, I don't suggest it for on a regular basis, but if you can get tuna that's packed in water instead of oil, or if you can get you some fruit that's in low sugar syrup, the low sodium canned goods, and don't cook them in that fluid that they're soaking in the can. Wash them off before you cook them and eat them. Talk to your dietitian if your dietitian is available, and they'll help you with some tips to make it through, and some shopping tips for during this time. But I understand that the canned goods and the sustainable foods are what you need right now. Um, get some Rice Krispies and some almond milk or oat milk, if you can, and don't eat the Raisin Bran. Just try to make wiser choices during this course of time. And
Absolutely.
those are things that are going to keep your lab values better, because if they start cutting treatments, your lab values are going to go up. You're not getting your full treatment.
Right. Wow. Just like to give a shout out to Shine Jackson for watching, new watcher. Thank you for tuning in. Uh, Calvin Bell, Andy Waba, Craig Brackens. Thanks, brother. Brian Olivius, Tamika, my partner. I love you. And Tracy Nicole Moore. Thank you guys for joining the watch party on Facebook. But Don, you're giving some great
Thanks so
information.
much.
Even
So
Sean
much.
Jackson says Don is giving some good information. And you're welcome, Sean. Just check us out each week. We're on here. Come to Urban Health Outreach Media. We're going to have a schedule out of our shows and the dates, the days and times that'll be coming up. So thank you guys for watching. So Don, you have any more tips? We got
Well,
a couple of more minutes before Warriors Quest with Jared A. Brown, guys. So you think this is a great show? Just tune in at 8:30 for Warriors Quest to hear someone plea for a live kidney donor and hear their journey. This thing is bigger than us. We're just trying to
yes, it is.
shed light for people who normally are not able to get their voices heard, who may think they're alone, who may think they're going through this by themselves. But just know it's more than 500,000 people dealing with the same disease. So Don, what is your how many more tips you got? You got maybe like one or two. I know we got a part two. So guys,
Yeah, I'm gonna save the rest for part two, and
well, you have one
just
more that you can give.
let's see here. Uh, One of the big things is avoiding travel. Now is not the time to plan to take a trip. From what I understand, you can't even get booked at a dialysis center out of town if you do decide that you're going to travel. So this now is not the time to plan your trip. They're not accepting patients from outside facilities. So now is the time for us to stay put and sit tight
Hey
until
Don,
this wave passes over.
let me
Yeah.
interject right there. Is that the same
Yeah.
for home dialysis? If somebody wanted to travel, if you needed your supply ship, are they putting a halt on that as well?
No, that's not the same for home patients. Home patients, they are shipping your supplies if you decide to travel. However, now is not a good time to be roaming about. I would just put it that way.
Right,
But
right.
no,
No, I
we haven't
understand.
re-
That's understandable.
we haven't seen we haven't seen too many interruptions in delivery. I know some patients are having some problems getting their delivery, some home patients, but it's not on a broad scale.
Sure, sure. Now, before we go, do home patients get masked with their supplies?
Absolutely. We get masks, sanitizer, paper towels,
So have your supplies been
gloves.
interrupted?
Absolutely not. I have an abundance of supplies.
All right, I know where
I
to
have a
come.
li- yeah, I could do a little side hustle out on the corner, right? No,
You're
you
right,
know,
right.
I mean, I'm not stockpiling supplies, but I have enough, so that I'm not worried about, having hand sanitizer or paper towels or,
Sure.
chucks and things like that. Yeah,
And you know what? I guess that would be another added benefit for home dialysis, that you get these
absolutely.
supplies. Whereas if you were
That's
going
right.
in center, they're not going to give you supplies to take home. They're not going to give you hand sanitizer to
No,
take home, or any of the stuff
no.
that you're privy to have as a home patient.
Absolutely. And, I already know how to do self care. So I do my catheter care and everything myself. So
Hmm.
I have everything that I need here.
Hmm.
It really is a benefit, Steve. That's
Hmm.
why I try so hard to share my story with with other patients so that they can really get the gist of not only do I feel good, and feel healthy and everything. Hey, Sabrina, there's my transplant buddy. She
Hey,
used to be
Sabrina, how you doing?
NYPD
Yes,
with her beautiful
absolutely.
self.
Good to see you,
Yeah.
Sabrina.
I hope you're doing good, sis. Uh,
Haven't seen
yeah.
in a
So
while.
not yeah. Oh my gosh, I just saw her on Facebook today. She's as beautiful as ever. She looks great.
Really?
Uh, yeah, she really looks good. That
Mm.
transplant is doing well for her. I hope.
That's awesome.
Uh,
That's awesome. I'm glad she's
yeah,
doing well.
yeah,
Yeah.
yeah.
So Don, man, I tell you, this is a lot. This is a lot
It is.
with this virus. So guys, if you want some more information, tune in this Friday, 10 p.m. Eastern Daytime, to
Hmm.
hear the rest, that is geared toward home dialysis patient, right, Don?
Right. Yeah, we're gonna talk a little bit about about home dialysis, and how home dialysis patients in it through this through this virus crisis.
Hmm.
Just a couple little tips.
So Don, before we let you go, after this is, I hope, over, what would you suggest for warriors who are not on home dialysis, who would definitely qualify for home dialysis? What would be your suggestion for them, in light of what's going on right now?
What's going on right now? Um my plea is to my fellow dialysis warriors. Don't close your mind to all of your options. Um, find out more about home dialysis. When people come around talking about it, don't just say, "Oh, I'm not interested." Listen and let them give you the information, and you really think about it, evaluate that information. Everybody has doesn't have a lot of room in their house. I live in New York. My room is the size of a child's room, but I have my machine, and all, and my supplies and everything. I have them in here with me. There are other ways to do dialysis. There are other ways to make it and live well and healthy with kidney disease. And don't close your mind off to your options. You never know. It may be the best thing that ever happened to you. When I started, I didn't want to hear anything about home dialysis either because I didn't think I was going to be able to do it myself. I didn't think I'd be able to put my own needles in and all of that. I had all of those same mindset, but I found out that it was the best thing that ever happened to me. And there's a whole bunch of other people who feel the same way.
Yeah, absolutely. I want to give a shout out to my partner, uh, Tamika Gainers, because
Hey, Tamika.
even though you guys who's watching only see her once a week, she is definitely behind the scenes making things happen. And
Yeah.
she's on the front line of this disease
Yes, she
because she is
is.
still taking care of kidney warriors where she works as a technician. So, man, I love this woman to death, and I asked the audience to keep Tamika and her family in prayer as she's out there day in and almost day out on the front
Yeah,
line, uh,
yeah,
battling this virus, and at times being put in conditions that no technician or healthcare worker should be put in, especially with having to reuse a mask when we before this virus use masks and just threw them away like they were nothing. Now,
yeah,
technicians and nurses are subjected to wearing these masks until they become soiled or wet, which is a
yeah, yeah,
travesty. So,
yeah.
uh, we're going to wrap it up. We got
All right.
Jared A. Brown, Warriors Quest coming right up. Guys, don't go nowhere. I know you're maybe bored in the house, uh, want to get away from the television. You may be watching Netflix. You may be tired of watching repeats of certain documentaries or comedies. Look, tune in to our shows because we're going to have some life-saving information that can make a
Yes,
difference in your life. I mean, and we need more than
yes.
10 people. We need like 30, 40, 50. It should be, hell, it should be hundreds of people on here across the globe listening to some great information on kidney disease. I mean, we want to make it go global, Don, but how do we do that if the mainstream, people say kidney disease is not talked about on mainstream? Well, how do we make it go mainstream? Let's get just one advice from you.
We just need everybody to pitch in and let's all do it together. We can make kidney disease go mainstream. If there's a 500,000 of us, if we all work together, what kind of that's an army that nobody can beat.
Absolutely. 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 500,000. That is an army no one can beat. Absolutely.
Exactly.
So, Don, I mean, thank you for coming on tonight. We got another part two to this that we're going to be
Friday
doing
night.
Friday night at 10 p.m. So, guys, if you missed this, just go back and rewind it once we finish and look at it, and then tune in this Friday, 10 p.m., right here on World Kidney News as we continue to talk about managing your health during the coronavirus, especially if you're a kidney warrior. We may have Tamika Gaines to add in, Jared Brown, maybe Lisa Baxter, or some more people to add some flavor to this discussion. Don, anybody you want to give a shout out to before we end this broadcast? Hello, Don. It looked like Don froze up. All right. So I'll say goodbye for Don. Thank you, Don, for coming on. You did a wonderful job. God bless you. So, guys, look, stay tuned for Warriors Quest coming right up at 8:35 p.m. Eastern Daytime, right here on Urban Health Outreach Media. Again, I'd like to thank everyone who's new to the broadcast, who was watching tonight. Sean Jackson, Calvin Bell, Sabrina, thanks for watching. I haven't seen you in a minute. God bless you, and I hope you're doing well. And everybody else who tuned in, God bless you. Again, stay tuned for Warriors Quest with Jared A. Brown coming right up. God bless. Stay safe, and peace and blessings.